Over the past decades, what change in pan-vascular medicine do you anticipate most? Is it technological breakthroughs or a fundamental shift in how we define disease and organize care? So this question is for you both. So Professor Cooke?
So I read an interesting editorial just yesterday in Cardiology Plus. So this is the Chinese Cardiovascular journal. Dr. Junbo Ge is the editor. His editorial spoke about how interventionalists are going to have to become vascular biologists. Because in the new era that's coming of interventional cardiac practice, there'll be new biological approaches that are going to be dramatically improve our ability to care for these patients. One of the things that I'm most interested in is vascular aging, whereas chronological age is not, that's immutable. Time marches on. Aging processes are modifiable. So we used to think of age as an immutable risk factor. But aging processes can be modified, and there's plenty of preclinical data to support that. We understand now the hallmarks of aging, what causes aging, cellular senescence, inflammatory cytokines, proteostasis impairment, mitochondrial impairment, DNA damage. And it turns out that these processes can be modified. So I think we're going to see in the next 10 years, we're going to see some clinical trials coming where we've actually been able to successfully modify these aging processes. I think that's going to have a huge impact on our field.
What about your opinion,
So
Professor
I
Li?
think for the society, just like Dr. Cooke before mentioned, we use the most sophisticated device. We use AI to help us to challenge the pan-vascular disease. For example, now we know how the patient, we can check the patient. For example, we can check the patient cholesterol level, let the patient input his lifestyle, and we can have the CRP, the inflammatory disease, and we can check the ABI, check the stiffness of the arteries, and we organize the whole system together. And we can start from already we got the data and develop some models, and the new word called what we call digital twins. So the computer tells the doctor, tells the patient, maybe in the future, maybe in another couple of days, maybe 10 years or 20 years, we may develop something like that. So if you want to prevent from that, you should start now by doing what blood, and by doing this, we can decrease the vascular disease. Just like Brownwood said, we can live to 100 years without aging artery.
Okay, thank you both for your insightful sharing.
你好，中国，东方问道。